In Health Now, earlier this month, the family of actor Val Kilmer announcing the star had passed away from complications of pneumonia. So this is a big topic right now. And according to the CDC, around 40,000 people die from this condition every single year. So here to join us this afternoon to tell us more about it and what to look out for, we have the Director of Thoracic Surgery and Lung Center at Jupiter Medical Center, Dr. K. Adam Lee. Dr. Lee, thank you so much for joining us.
My pleasure.
And as I mentioned, a lot of people are talking about this, and the conversation on pneumonia is so important. But first off, just tell our viewers what we need to know about pneumonia.
Well, I think pneumonia is a broad topic,
Sure.
but here the most important thing is it's an infection of the lungs caused by bacteria, viruses, as well as fungi, molds, and other things that can cause it. So it can be as persistent cough, or it could be fevers, chills. And these are things that should not be, let alone sit for 6 months. The earlier you get it, the better we can treat it and get rid of it.
All right,
Now, in Val Kilmer's case, he had a tracheostomy because of his throat cancer. So that had an opening in his airway into the skin, which has local bacteria and can always cause systemic infections with pneumonia. So that's what we call a extreme version of pneumonia, but simple things of people being over 65, immunocompromised, being near sick people, being near pollution, secondhand smoke, all those things can cause. And we've seen cancers cause pneumonias. A small little lesion can block the airway, and then it gets an infection around it, and you start treating with antibiotics, but it's not improving. You need to also rule out cancer.
And take action. We focus on the risk factors here, but talk to us about lung health overall. Anything you want to highlight? How can we keep our lungs healthy and free from illnesses?
Well, obviously, good hygiene, washing hands, staying away from sick individuals who are coughing, sneezing all over you, and paying attention to your own self. If you have a cough that doesn't dissipate, if you're having more secretions, mucus, which is turned from clear to yellow or green, having fevers, it's always easier to have it checked out earlier than try to repair it when it gets to a full-blown pneumonia where the lung becomes more stiff and harder to move back and forth, facilitating air exchange.
Yeah. Can we focus a little bit more on just lung itself and lung cancer? What should our viewers know about that?
Well, I think it should know that obviously smoking is a big thing, but 10 to 15% of lung cancer patients are non-smokers. And 2/3 of the non-smokers who have lung cancer are women. And so we have women who are non-smokers. We've had many patients in the 40s, 50s, and early 60s who come in for what looks like a pneumonia. Non-smokers are women with lung cancer. So we do at the hospital have a special program dedicated to women. During their breast exam and at our breast institute, we give them surveys to see what environmental factors and history they have so we can detect it while it's still very small. And that is why we looked at our data. We had a great response in this strategy, utilizing AI as well across the spectrum. 44% early detection of stage 1 and 60% stage 1 and 2, which is one of the leaders across the country when you look at that data in early detection, because we go out to help and facilitate the patients to know what their risks are.
It's so fascinating how technology advances, but this is such a benefit. And picking and doing the testing, but the preventative, but also attacking it right away as early as possible is something so important. Any final points you'd like to share, Doc?
There's no harm in ever contacting your doctor for a cough that doesn't go away, a fever, chills. The doctors are there always to help, and they're better to find something early than later.
Dr. Lee with Jupiter Medical Center, thank you so much for joining us and for talking to us about this topic today. And we'll be right back.
My pleasure.